Denisoff, welcome to the Wellness Lab. Pleasure to have you.
Thank you. It's a
Yeah,
pleasure
it's
to be
great.
here.
So just in case people aren't haven't done their background on you, what is your general area of expertise, just to let our listeners know?
I can tell you that I worked as a registered nurse and then had a particular interest in clinical psychology and mental health specifically. So I became a clinical psychologist, which means I obtained a PhD in clinical psychology specifically. And what I did as a clinical psychologist was to work in various areas as part of my training and learned a lot as part of the education, a lot of breadth of knowledge. And one of the areas that I was especially interested in and did a lot of work in is the area of anxiety disorders. That's generally what I was hoping to speak about with you in more
Lovely.
detail today.
And just just to warm everyone into this subject because it's really relatable, it's broad. What would you say is the average person's understanding of anxiety? So no training, no experience in this field, anxiety, what's their perception?
Yeah. It's a great question. I mean, it takes me back just to some of the work I did. I worked at the Center for Addiction and Mental Health, at the Anxiety Disorders Clinic, at the Psychological Trauma Program. And, I'm reminded of clients who came in presenting with anxiety. And often people were very confused about what is anxiety. So it's a good place to start. Some people would come in saying they were having cardiac symptoms, heart palpitations, and for some reason their family doctor sent them to talk to me. So they were a little
Mhm.
bit confused, right? I remember somebody, it was a big group of people, and I asked people, what's your understanding of anxiety? And one of the gentlemen said, it's what my sister takes Valium for. So that was another, kind of intro
Yeah.
into what is anxiety. And I think that there's a lot of confusion around what anxiety is. So I think people hear that, yeah, it's a mental health disorder. Some people say, that they were told it means there's something wrong with their brain and they'll have to take medication forever. So a lot of mixed and different messages out there about what
Yeah,
anxiety
and that's
is.
such a yeah, what an experience as a psychologist coming in and the your client is like, I don't really fully understand why I'm talking to you. Like, it's
That's
such
right.
a yeah, and then there's definitely that camp of people as well that hear anxiety and their brain jumps to this is an issue and I need medication. And that's such a group of people and there's not that's not the most sophisticated way you can I think about anxiety at all.
Yeah, well, I think your question is a good one in terms of, a lot of people will say, well, I heard of it, I know what it is, or I think I know what it is, or I know that I feel it, but I don't think people have a really good working knowledge of that term or the system, right? It's a system in our body. It's very natural. It's naturally occurring. It's not like, you have anxiety and I don't have anxiety. We all have
Hmm.
anxiety, right? And that's a good place to start when we're talking about anxiety. It's our fight or
Yeah.
flight response. We need to have it. It's a protective system and it gets activated when we need to move quickly in order to increase our chance of survival. It's a
Yeah,
survival
and
instinct.
I think that's going to be the bulk of our discussion today is that it's a body reaction, and then everyone this is one of the things that always stuck out to me when I was looking at different psychological podcasts and health podcasts is everyone seems to jump to up the applying it and all the strategies, and of course there's value in that, but they don't spend enough. I feel like they don't spend enough time on okay, what is it? What do you think about it? Let's define it. Let's clarify what it is. Now let's go apply it because there's so much value in that. And then if you're going and trying to fix your anxiety and you still have this perception of it's like, oh, it's this emotion that's in my head and I need medication, but I'm gonna maybe try and do it with it, without, whatever it is, or maybe you think, oh, it means I'm crazy. You're not going into the
right?
solving process, having put the right foundations in place. And there's so much importance there.
Well, I think, Ben, that's a good point. I mean, for myself as a psychologist, I practice cognitive behavioral therapy. Cognitive behavioral therapy is a short-term approach, and our job, right, in the field is not only to really know and understand anxiety extremely well, but to help our clients understand it so that they essentially become their own therapist. So if we don't lay that foundation well, and people are just thinking that it's a problem, it's a bad thing, they want to get rid of it, then we haven't done our job well in terms of, really helping people understand, hold on, right? We don't want to get rid of it. If you got rid of it, you don't have a
Yeah.
survival instinct. That's not a good thing,
Hmm.
right? What's next? Splat,
Yeah.
right? So, you know, a survival instinct is essential, but if your system is a little bit more sensitive in some
Hmm.
areas than other people's, right? Then we definitely want to identify that. And that's part of, diagnosing, right? Are we working with, if we look at anxiety disorders, right? It might be panic disorder. It might be social anxiety. It might be, it used to be obsessive compulsive disorder. Now that has kind of a separate category. But there's a whole spectrum of anxiety disorder. So you really want somebody who understands, knows, and can help you sort that out. And that usually requires a really good detailed diagnostic interview and assessment so you know exactly
Yeah.
what
And
you're
what would you
dealing with.
say to someone who is going to come into this whole process of re-understanding anxiety in with those misconceptions that we just talked about, feeling like you need medication, feeling like it's just in your head, or feeling crazy? What would you say to start reshaping that so you can move forward?
Okay. So I think I would begin with exactly that point that anxiety is normal, it's natural, we all have it. So our goal is not going to be, so maybe we're going to start with setting our goals right early
Hmm.
on in our meeting, right? As we do the assessment, understanding that our goal is not going to be to get rid of our anxiety, but it will be to get a good, accurate diagnosis and then appropriate treatment. So for example, if you're driving on a highway and suddenly somebody swerves into your lane, you're going to need to react very quickly. Heart rate will go up, your breathing will change. We want people to know that you need that rapid fight or flight response, that rapid reaction time in order to survive. But if you see a little spider crawling across the floor, you don't need to scream and jump and run, and turn off that anxiety, right? If it's excessive there, if it's kind of an oversensitivity, that would be like a specific phobia of spiders, or it could be specific phobia of dogs. In that case, what you'd want to do is to learn how to work with that so you're not overreacting, right? So if you feel anxious and you're uncomfortable with the symptoms, you're going to want very quickly to somehow turn them off. So it could be escape or avoid that situation. It could be take a medication,
Hmm.
right? Um, but what we want you to do is really know that even though anxiety can be really uncomfortable, it's
Yeah,
not
it's
dangerous.
a yeah,
Yeah,
it's a body function, and I
yeah.
think yeah, the words sensitivity, even before we started discussing it more, that really caught my ear because that's really is the perfect word for it. Because if like we're gonna take an evolutionary
Mhm.
perspective here, you're 2,000 years ago, you see a lion in front of you. You want adrenaline in that moment. You want your pupils to dilate. You want to breathe faster. You see this little animal,
Yeah,
maybe you don't, and so that's a range of sensitivity of and how yeah, it's a range of how sensitive that body response is, and that's something we really emphasized in our pre-discussion as well.
yeah. And I think you make a really important point. When you look at the list of symptoms that are part of our
Hmm.
anxiety response, and I tell people, don't get fooled by anxiety, right? If you feel something somewhere between the top of your head and the tips of your toes, it could be anxiety. Why? Because what happens when we feel anxious and we think about that fight or flight response? You're right. Our pupils
Hmm.
dilate. Our breathing gets rapid and shallow. So we could have a dry mouth, right? Our heart rate increases. Our blood flows away from the periphery into our
Hmm.
core. It's protective. If you were to get scratched by that saber-toothed tiger, you're less likely to bleed to death, but you really feel numbness and tingling in your extremities. Your GI system shuts down because it's not so important to digest that meal you had
Yeah.
for breakfast if you need all your energy to outrun that saber-toothed tiger. So the symptoms of anxiety are from the top of your head to the tips of your toes. And a lot of people forget that there's a long list of those symptoms: rapid shallow breathing, dizziness, heart palpitations, numbness and tingling. All of those things are part of the anxiety
Yeah.
response.
And just, I think this is going to be a really important topic for us today. Can you go into why being able to identify these are my anxiety symptoms, here's how my body specifically reacts to anxiety? Can you go into why that's important for mitigating it?
So, yeah, absolutely. So, the way to understand anxiety, right, is to identify. So, most of us are pretty good at identifying, like, my heart rate just went up. But what we want to check in with is our thoughts. So, our thoughts affect our emotions, affect our behaviors. So, with anxiety, often we're feeling anxious, but we want to come back to what are we thinking. So, one way to understand why that's so important, Ben, not knowing you better, I'll ask, do you have any fear of dogs? Are you a
I
dog
am.
lover?
I do not have a fear of dogs. Do you want me to for the sake of the
No fear
analogy,
of dogs.
or? Okay.
Not at all. Not at all. But I'll tell you, when I'm teaching a group and we have 25 people in the classroom, at least one person, usually I'll ask people in the group, anybody here afraid of dogs? And at least one person will say, yeah, not a fan, right? I don't like them.
Mhm.
I'm afraid of them, right? And other people are like, oh, so sad, unfortunate. The difference is not that it's not the dog, it's
Mhm.
not the stimulus, it's what you think
Yeah.
of the dog, right? And so in that case, the person who's afraid of a dog, and I'll often say, so when you see a dog, what do you think? And what they often say is sharp teeth, dangerous, might bite or attack me, and so then their anxiety system gets activated. But if I ask somebody else in the group who's not afraid of dogs, when you see a dog, right, what do you think?
Mhm.
And most people respond, man's best friend, wonderful pets, beautiful, fur, whatever they think. You can understand how if you thought one thing, you'd have one set of reactions. And if you think another thing, you'd have a very
Yeah.
different set of physical
Yeah.
reactions, right? And that is the essence of, our thoughts affect that emotional response and affect what we're going to do, right? Because if you feel anxious, your immediate um, response, right, is to get out of that situation and avoid it in the
Mhm.
future. If you don't have an anxious response, then you might very likely feel like
Yeah.
approaching this situation. Is your dog friendly? Can I pet your dog? What a beautiful dog. Very different, but it's about how we interpret those
Yeah.
situations.
That's the right. That's perfect. It's same stimulus, exact same dog, different response. And so by understanding
Correct.
it's a body function, it's caused by what you think
Right.
about it. And that's really the essence of CBT. You identify, okay, this is what you
Yep.
think, which causes here's what your body reacts. Okay, and what are we gonna do about that? And it really follows
Yes.
that structure.
Yeah. For a lot of the people I worked with, it was like an epiphany for them to realize that we're not here to argue our dog's dangerous, our dog's not dangerous. A dog could bite,
Mhm.
right? And so, you're not going to argue that. Or You could go up to do public speaking and forget what you were going to say, and have to come up with another strategy, or come up with some other idea in the moment. Or you could go on a date and it might not go well. But if you then avoid going on a date, public speaking, walking out where there might be a dog, then anxiety can shut your life down and make it really
Yeah.
small. And that's
Yeah.
what we don't want. We don't want avoidance, because if you start to avoid in the short term, what happens if you avoid that situation that makes you
Well, short
uncomfortable?
term, you're comfortable. You're okay. Long term, that's where the issue
Yeah,
comes in.
exactly. Short term relief, but long term, just more and more and more avoidance. Your world gets smaller, and anxiety is now, really kind of directing your world,
Yeah.
your life.
And what's the value in being able to say identify in the moment? Because this is something I worked on in my own mental health
Hmm.
journey of identifying the your own body symptoms to go, oh, anxiety is happening now, and being able to recognize it in the moment, so then you can then go, okay, should this be here, yes or no?
Right. Okay. So I think it's a great question. I mean, what I encourage people to do is, one, identify, what am I
Mm-hmm.
thinking? Right. So again, like with the dog, am I thinking, vicious animal going to hurt me? Am I thinking, best
Mm-hmm.
friend? So you want to identify what you're thinking. But the other piece is, I'll often ask clients, and if you're comfortable, clients, patients, whoever, friends, family, anyone, when they're trying to understand it, the question is, get people to think about, and I'd encourage anyone listening to our podcast, to really say, has there ever been something I was afraid of that I'm no longer
Mm-hmm.
afraid of? If you're comfortable, you can share your own example, or I'm happy to share
Yeah,
an
and that's
example.
yeah, that's that one question I think is such a little piece of wisdom that I loved from our pre-discussion, because it just being able to say,
Hmm.
"Hey, I was scared of." So, okay, so let's take myself. Scared
Okay.
of water early on, a little bit,
Okay.
and now, okay, go do when I was a very very little kid, go do swimming lessons, and then that
Yeah.
slowly, so I could go in with my mom when I was however early you start swimming lessons, 3 years old or whatever it is. Came in,
Yeah.
okay, I feel okay.
Yeah.
All right, let's try the first lessons without her. Okay, let's try some harder skills. Okay, and so you slowly just kind of build that accustomed. You build being accustomed to that,
Yeah.
and
Yeah.
it's been 4 years now that I'm a lifeguard, so you can just slowly kind of expose yourself to
Fantastic.
that, and then become a lot more
Yeah.
comfortable with it.
Bingo. That's an excellent example. And what you described there is what you
Hmm.
engaged in for the swimming lesson. So identified the fear of water, and, not sure you identified early on what were the thoughts, but kind of foreign, don't know what to do,
Hmm.
maybe afraid, it'll hurt me somehow. But what you did is gradual
Hmm.
exposure, which is the treatment for anxiety. On gradual exposure to something we're afraid of, you can think about learning to drive, learning, swimming, overcoming a fear of water, public speaking, dating, any kind of situation. On repeated exposure, and you want the exposure to be gradual, right? What you learn is essentially you're teaching your brain, this is not all
Hmm.
danger. It's not what my initial thinking about it was, right? So repeated exposure gradually leads to habituation. And then your anxiety is no longer
Hmm.
kicking in. And that's how you conquer a fear. Whatever the fear is, you need to set up what we call an exposure hierarchy. And then you walk through those steps. You don't have to jump in at the deep end. That would be called flooding. And it can work. I mean, there is some research to support that flooding would work. But if I tell people, oh, you're afraid of public speaking, well, I'm going to get a group of 20 people together, come in next week and you can do a public presentation. They don't come back. They're like, yeah, no way. Too much. But if you do it gradually and you work together to identify what are those steps, I'm going to feel some anxiety, that's fine. But I'm going to learn by going and working through those steps. I'm absolutely going to learn that on repeated exposure, habituation occurs. I could get over any
And
fear.
that's really how you learn to identify what situations is a anxious response justified, what situations isn't it. Because you start and
Right.
because you sit back before you begin. Okay, is this something I need to be scared of and need to have an anxious response to? Okay, let's go try it.
Right.
It's been okay so far, and you slowly ease yourself into it, and then over the course of becoming comfortable with that, you can realize, oh, this maybe isn't something I need an anxious response to, or maybe an anxious response with lower sensitivity.
Yeah, absolutely. I mean, most people, I think the most common, anxiety is public speaking, right? But if we practice it and we do it over and over again, and people find ways to be able to do that, challenge yourself instead of avoiding, you can conquer all kinds of fears, right? Most of us driving, right? It takes a little bit of effort. There's so much going on, and we're just getting used to all of this, but gradually, right? People are driving and having a conversation, listening to some tunes, sipping their
Mhm.
coffee, like, maybe almost too much. But the idea is, you don't want to start avoiding things. You just need to build a plan, a program, in order to approach it, and you can get over
Yeah.
all kinds of fears. So,
Yeah.
yeah, great example. I love it that you're a lifeguard
Hmm.
now too. I mean, that really takes it from starting with the fear to, really overcoming it. Probably able to
Yeah,
help others
definitely.
too.
And you'll see, yeah, and I'll see when I'm teaching particularly young kids. I mean, fear of water is present at any age, but especially when they're a little bit younger, like, and this is something that really helped me get over fears and my own anxieties and stressors in
Mhm.
my journey was when you go into it, okay, what are you feeling right now? And so I'll say this to a kid and I go, I feel nervous, I'm kind of, and then they'll describe it and they'll pick a body thing or two, I'm a little shaky, I'm this and
Yeah.
that, whatever. And I go, okay. And so
Right.
that's such an important step to identify, okay, what's my body doing? Okay, what's my body doing in this moment? All right, then does this need to be here? And so we're gonna take a step forward and we're gonna wait for that to cool down. We'll take another step, we'll wait for that to cool down. And understanding how your body reacts, it gives you it gives you a little bit of a gauge of how you're moving through it and if you can move forward or not.
Yeah. Yeah. And it's lovely that, you can have such strong empathy, for those little ones who are having that fear. It's
Hmm.
something you had yourself. It's very powerful, to be able to share that with others in terms of understanding that, maybe some self disclosure around, I used to think that way and I used to feel that way. And how do you think we could, get over that? And even children can come up with good examples of, you know, was there something you were afraid of and you're no longer afraid of? Right. And so they get used to that. And for some, it is a puppy, a kitten. It was, doing something, uh, sleeping with the lights not on or something, and a lot of people can come up with an example, and it really helps them to realize, hey, I have gotten over fears. I
Hmm.
have gotten over fears. I can do this too. I just need to
Yeah.
remember how.
And what are
Right?
I'm interested, so as a CBT specialist, what are some approaches someone might take to identifying areas in their life where that fear response is needed versus areas where that fear response maybe isn't needed? Because we touched on that saber-tooth tiger example and being able to
Right.
label areas of life where you can say, no, this needs to be here. Maybe it's a little bit too sensitive, but it does need to be here versus areas where it doesn't. And kind of taking a step back and looking at it that way.
Sure. It's an interesting question, but I guess, fundamentally, we want to appreciate that we all have that
Hmm.
fear response because we all need, right? If we didn't have it, we would be doing things that are potentially foolish and dangerous, right? So, you know, not approaching like you want to have some caution around approaching an
Mhm.
animal, right? About driving within certain limits, because outside of that, it is dangerous, right? Um, I don't know, summertime is coming up, and some people love to dive off of cliffs or jump off of cliffs, right? Or, you know, um, you need to really do an assessment and think about safety, because some anxiety absolutely makes us safe. What we don't want, Ben, is for anxiety to be limiting our life. So if public speaking, makes us uncomfortable, and for most of us, yeah, we might think about, I won't know what to say, or my mind will go blank, or I'll sound stupid, whatever the thought might be. But if we avoid doing that, then it likely limits us in terms of interacting with others, in terms of career choices, educational
Mhm.
choices, right? So, we want to know that, for example, it's okay to have some anxiety around writing an exam or doing a class
Mhm.
presentation. You want to prepare, you want to have enough of it to do a good job, but not so much that it shuts you down.
Yeah.
you know going going on a date for young people, right? Going on a date, it wasn't an uncommon thing that people would say they felt anxious about. And the fear of rejection, being judged and negatively evaluated, that's also pretty universal. Most
Mhm.
people have some of that. But again, you don't want it to prevent you from being able to interact and getting to know people. So you might need to practice making small talk and just engaging with others, and just practice it and see what actually happens. And for the most part, people report, oh, well, someone was more anxious than I was, or, somebody told me something that I found really interesting and I learned something. So again, it's about not ignoring it completely, but not
Mhm.
letting it limit
And
your life.
yeah, I liked that. I really liked your point about, okay, there's an exam coming up. I should probably have some nerves about that because that pushes me to study and to be prepared and all this. And this is a conversation I had with my therapist a while back, as I came in and I was thinking, I was having a lot of overthinking difficulties, and I came in with the idea of like, I gotta get rid of this. And then so I sat down, I explained it, and then very delivered very well. My therapist goes, so she points out some areas in my life that are going well. Okay, you go to the University of Toronto, you have a great GPA, you are working as well, you run a podcast. This is all
Yeah.
going well. Do you think you would achieve those things if you weren't overthinking? So this has pushed you, this feeling, this should be here in these areas, and it's pushing you to be successful. So don't run away from it. You have to lean into a little bit in these areas, and then you can get comfortable with it. And that totally changed my approach to it, and it was really helpful.
Yeah. I think what you described there, without using the word, but one of the forms we use in cognitive behavioral therapy is called a thought
Mm.
record. And so what you do is you start with the situation. In your case, it's, you know, thinking about exams coming up. You identify the emotion, I'm feeling anxious. And, then you identify some of your thoughts like, I won't do well, this will affect my education, my career, my future, my potential. And then what you moved into is the next column, which is, where's your evidence for that? Well, my heart is racing and my mouth is dry, and my thoughts are kind of coming quickly. And is there any evidence that doesn't support that you're going to
Mhm.
fail and everything's going to be terrible? Well, and all those things you mentioned, I got accepted to the University of Toronto. I, have a good GPA. I'm, doing well in my courses and running a podcast. So there's evidence that doesn't support it. And then what you had to come to is a more balanced thought. So the more realistic, the more balanced thought, taking into account both sides of the evidence, is that yes, I'm feeling a bit uncomfortable and I've done that before, but that just pushes me to
Mm.
apply myself and do better. And chances are this will be
Yeah.
okay as well. And now, when you're thinking that way, the anxiety is generally a little bit
And it
lower as well.
especially helps when you realize that other people are doing this as well. It's not just an issue with you, and you can identify that yeah, everyone gets nervous for exams. And you go, and that helps you realize, oh, this is just something that is serving me right now. And because
Exactly.
it occurs in everyone.
Exactly. And if somebody didn't have enough anxiety in
Hmm.
that situation, then they might be out doing other things and not spending enough time studying, and that might affect them adversely when it comes to exam time. So you want to have some anxiety is a great example of, anxiety is helpful. We need some, it motivates us, it, pushes us, and that is important
And
as well, right?
that's definitely a stigma I think people face very, very frequently is the idea that I'm the only one that thinks this way, and they don't realize that other people have this same thought pattern. And it's such a helpful thing to have people around you that go, "Oh, you're nervous for an exam? Yeah, me too. Let's study together." And it helps you realize that that's normal. Yeah. And so I'm interested,
Right.
what were some in your practice, what were some stigmas that people often came in with about anxiety when they were starting their mental health journey, so called?
Right. So I think that some of the things I heard early on is, perhaps the one that you just mentioned, kind of if I'm feeling anxious, that means there's something wrong with me. If I'm feeling anxious, it means I'm weak. If I'm feeling anxious, it means I'm not competent. And those are the kinds of things that anxiety means. It's interesting because personally, I think that there's room for all of us to rethink anxiety. So people talk about anxiety as a mental disorder, and it's definitely in the diagnostic manual. And there, is a spectrum of anxiety disorders. But Ben, I really believe we'd be better served to understand that anxiety is normal and we all have it and we
Mhm.
all need it. And rather than think of this as weakness, mental disorder, lifelong problem, needs to be medicated, all of those kinds of thoughts around it, I think we would be better served to understand that anxiety is normal, it's
Mhm.
healthy, it's protective. We all have anxiety, but we do want to identify areas where maybe our anxiety is oversensitive. So if I'm screaming and running away every time I see a bug, maybe I should learn to kind of get used to bugs being around. They share
Mhm.
the world with us. So maybe it would be important for me to work on sort of challenging that. Right? If I avoid being around people, it's not going to serve me well in the long time. Then you want to work on how can I gradually start to approach interacting with people, and learning that they're not all saber-toothed tigers, although some might be. Right. So I think we really, really want to normalize anxiety and we want to understand, you know, that it's not necessarily only solved by medication. In fact, medication in the short term, you feel
Mhm.
better, but it's short term relief. Long term, your brain is actually learning, oh, that's dangerous. I need to take a pill. That's not what we want people to learn. It's like, that's not dangerous. But when I think about it that way, my anxiety gets activated. I'd like to engage in some therapy that will allow me to, even if I'm on medication, to gradually, talk to my prescribing, practitioner about decreasing the medication or even going off it. If I can get my hands on the right therapy and make good progress, I don't need to be on medication. Right? So let's think about anxiety as normal. Let's think about the healthy ways to treat it, right? Exposure and response prevention, challenging our negative thinking, and then learn to kind of live with that in a way that, maximize where it's helpful for us, but don't let it
Yeah,
control
and
our
understanding
lives.
it as a body mechanism as well, I think is so helpful because, and this is something that really stood out to me in early in psych
Yeah.
is it's built into my program that you have to take a certain number of courses in the socio-developmental area and a certain number of courses in the clinical and neuroscientific area. So it's built into the program that you want this mental understanding of it and this physical understanding of it. And you really get such a deep understanding of the phenomenon when you have both together. And then that collective understanding that breaks down the stigma so well.
Absolutely. Absolutely. And unfortunately, I don't think historically we've done a good enough job of teaching that, but I think there are a lot of people out
Hmm.
there now, who actually really get that. And, just because it's treated, um, through therapy, so psychologically, it doesn't mean there's no physical component to it, right? But we don't need to medicate that physical component. We really want to, learn and give ourselves a more permanent solution as well, right? If you are taking an anti-anxiety medication in the short term, you will feel better. But what's your long goal, right? Then you take it forever. That's not necessarily helpful. That's not what we want, right? We want to overcome it long term. We need to do exposure, response prevention, challenge some of the negative thinking.
Absolutely. And that ability to say,
Yeah,
this is healthy, this is necessary, I'm going to work on the sensitivity, not removing it. It's such a different approach.
that's
And I think I really just do want to point out that this discussion so far has followed
mm,
that kind of structure of we talked about understanding it. What is anxiety? What do people think about it?
yeah,
And then what's the body
yeah,
reaction? So what's your body doing? We touched on adrenaline and your pupils dilating, faster breathing, all that stuff, and then how to
yeah,
change it. And that's the structure. Would you say that's how CBT approaches anxiety?
yes, yeah. That's a great
Hmm.
observation, and that's exactly. I hope that most people listening to the podcast will be able to identify something they have been afraid of that they're no
Hmm.
longer afraid of. When people start to think about it that way, they really understand. I'm afraid. That means I'm thinking something is dangerous. My body reacts because that's what it's built to do: danger, escape, or avoid. But if I do that, so I have the thoughts, I engage in the escape or avoidance behavior, right? I'll never turn that around. So I think one of the powerful pieces, several of my clients had said, what they understood is instead of running away from your fear, you need to run
Hmm.
towards it. So you really need to approach it because we're built to run away from it if it is in fact a
Yeah.
saber-toothed tiger, but it's a misinterpretation of danger, right? And when you think, public speaking is dangerous, that can limit you, certainly academically and in your career and interpersonally, right? But if you learn that by approaching that in a gradual, systematic manner, you can actually overcome that fear. That's really what we need to know. So don't run away from it. Run into your run into
Mhm.
your fear. And and the other piece is don't believe everything you think. Right? You can think something. That doesn't make
Yeah.
it a
One of
fact.
the during my mental health journey, one of the phrases that got used in my household often was "your brain is not your friend." It's
Okay, yep.
it can be, but there are other times where yeah, and that's I feel like that's the same essence. Don't trust everything you think. Absolutely.
Yeah, and it's not always your friend. It's we need a brain. We certainly need a good brain that works, but you know, don't believe everything you think because a lot of people will say, "Oh, little example, I'll say, "Oh, there's a kid sitting on the stairs crying. Little kid, why are you crying?" Well, the other kids don't want to play with me. Well, how do you know that? Well, that's what I thought. Well, would you say, "Okay, keep
No,
sitting there
of
and
course
crying"?
not.
No, you say, "Well, why don't we check
Mhm.
it out?" And the kids might say, "Oh, we were waiting for
Mhm.
another player. Join in." Oh, you don't know right? If you just stop with your
Yeah.
first thought, right? Don't believe everything you think. But yeah, if I don't apply to grad school because I think I won't get in, guess what? You won't get in. So, you need to challenge. If I don't, apply for the job because I think, oh, I'm not good enough, you won't get the job. So don't believe everything you think. Challenge those thoughts, use the thought record and challenge it
And how would you
behaviorally.
recommend someone build that into their mindset when they're trying to change how they think about anxiety and building that into just their normal thought pattern?
I think just very basically, when you're feeling anxious, so what you'll probably notice first is that feeling of anxiety, wherever you feel it. Some people feel it right in their gut, they'll be like gut wrenching something, right? Some will be palpitations, others will feel dizziness. When you notice the sensation, then check in with, what am I thinking? Because something activated that, right? And then what am I feeling like I should do? Right? And I'm feeling like I should leave or avoid or get out of the situation. But that's really fundamentally like, when I start to feel anxious, what am I thinking? Right? And what do I feel like doing? Because there are two ways we can intervene. One is change what I'm going to do. Don't run away, don't escape, don't avoid, approach. The other is, don't believe everything you think, but think about the other possibilities. And that allows you to stay in situations, learn something
That's
new. Yeah, not simple, but I mean, it's doable. And it's, check in with your thinking, check in with what you feel like doing, but make the plan to avoid gradually system.
that's such a I like how practically you put that, is that the first thing you want to do is catch the thought that, oh, this is anxiety, and then you kind of have these paths. You go, okay, do I want to go towards this, or do I want to maybe change how I think about this? And then you can assess the situation and identify which route is best.
Yeah. Yeah. And if it's too big a step, you might want to think about, well, I do eventually want to approach that. Are there some
Hmm.
smaller steps I could take before I do that? So breaking it down is fine, right? Breaking it down is okay. Breaking it down into manageable pieces. Sometimes I'd ask people, right? How do you eat an elephant? Seems kind
Hmm.
of overwhelming, right?
Yeah, yeah,
One bite at
exactly.
a time, right? So if something seems really big, just break it down. It's kind of a graded task assignment. Just identify a small initial step, next step, next step. You don't need to take giant steps. You can take small steps and still make progress.
Absolutely. And just having a path, because one of a great story that I use as an example of mental health journey is
Hmm.
so Terry Fox, when he was running across Canada, he wouldn't think,
Yeah,
I need to get from I need to get from the East Coast all the way to the West Coast. Oh my God. Like,
right,
that's such an overwhelming task. And so the story goes, I'm not
right,
sure if this is true or not, he would think, can I get to that lamppost? Okay, let's run up. Okay,
right.
got there. How about that one? How about that one? How about that one? And so you take it in steps over time. And it makes the
Yeah.
whole overall process so much more manageable. And at the end of the day, you look back and you're like, oh my God, look how far I ran.
Right, right. Yeah, it's a great example, right? And graded task assignment, just breaking things down into manageable steps, it absolutely allows us to get from A to Z, but we don't have to do it in one leap. We can actually take those small steps and achieve whatever it is that we were setting out to achieve, right? Small, manageable steps absolutely gets
And
us
how would
there.
you recommend someone just build that into their life, as well as having those practical steps that they can use very easily in their life? So if they listen to this and they can go out later this week and say, okay, here's an example. Let me try step one.
So, what we usually do, when we're working with anxiety, we create what we call an exposure hierarchy, and that really is our step
Hmm.
by step approach. So, um, to do that, let's say we'll use the simple example and maybe consistent with the conversation, but let's say you're afraid of dogs. And so your step number 10 at the top of the hierarchy, and there you'd say, that's my 100% anxiety to pet a big
Hmm.
black dog. Okay? 100%. And what's that 10% anxiety at the bottom of that hierarchy would be, I could look at a picture of a dog. Okay. So you can look at a picture of a dog. Well, let's start with that. What about seeing a dog outside the window? Oh, that's a little bit more like 20. What about you know, going to a dog park and staying outside of the fence and watching some dogs run around. Oh, that's like a
Hmm.
40. I would be feeling that one a little more. Okay, well, we'd start at about a 40, right? And then go and sit, watch, observe, put yourself in the situation repeatedly until that doesn't make you anxious anymore, because our brains are learning and your brain will figure out, okay, I'm comfortable, not dangerous, right? And then what about petting one of those small
Hmm.
tame little dogs? Oh, okay. Or just, getting closer to it. And so you actually identify very specifically what are
Hmm.
those steps. Start at about a 30 or 40% anxiety, so you know you're feeling it. If you start too low, it's like, yeah,
Yeah.
whatever, waste of time, doesn't feel
Hmm.
challenging. Start at a 30, 40, keep
Yeah.
moving up till you get to your biggest fear, and then you can conquer it. You can do that for fear of driving, fear of public speaking, fear of whatever might be on your list. Think about it that way, gradual, systematic steps. Your brain will figure that out. You will be able to achieve, fear of flying. That's another common, fairly common one, right? But people figure that out, take those steps, watch planes take off, get to the airports, take a short flight, and eventually, right, they can get on and do the long flight. You don't want to limit
Absolutely.
your
And
life.
using those body markers along the way is being able to put yourself in a, let's say, 30% and be, okay, there, put yourself in the lowest percent where you can feel it, then wait for that to go away, and then move up 10,
Yeah,
maybe 10, 20%. Okay? Yeah, there's tingles now. Okay?
exactly.
Don't wait for those to go. And you progressively do that until you're on a 10-hour flight, you're petting dogs, whatever it may be. Absolutely.
Exactly. Yeah. And that's called
Habituation.
habituation, right? That process is actually called habituation. On repeated exposure, right? The anxiety curve comes down and down and down. And once you've managed that and you're not feeling super anxious about it, move on to your
Mm.
next step. That's a great way of describing it. It's actually called
Habituation.
habituation,
Yeah.
right?
And so
Yeah.
I think I think that's a pretty comprehensive view that we've structured out. And so I just want to
Yeah.
end on one little piece of wisdom. What one piece of advice would you give to someone who is starting their path towards becoming habituated to their fear in life?
Yeah. Okay. So I would simply say to people, anxiety is highly, highly treatable. The most important thing for you to know is that if you understand anxiety well and you work with somebody who can help guide you in the right direction, right, you
Mhm.
can overcome anything. And I really believe, Ben, that it's important not to, stigmatize having anxiety. We all have it, but some of us have extra anxiety in certain areas for
Mhm.
whatever reason, but it's highly treatable. Our brains are constantly learning. We're capable of change. We're capable of learning. Be hopeful and, challenge your fears. Don't let them hold you back. The whole world is out there, and people overcome their fears. It's interesting. You and I spoke briefly, um, about, I had been away and recently got back, and it was amazing. I'm now 7 years into my retirement, and I got a lovely text message, and I still have people contact me, and it was like, Dr. Denisoff, I don't know if you remember me, but my whole life changed because of the work I did with you. And I overcame my anxiety. And I just think about you often because I know what I need to do now. If I get anxious about something, I know how to take those steps. And it was like, I am so proud of the hard work that people do to get better. And my job is simply to teach you to become your own therapist. And I write back and say, well done. Like all the hard work you did to get there, you deserve to have just the most rich, interesting, healthy life that you can,
That
right?
is that. that one line, becoming your own therapist, I think is so great, and learning to that you're never cured, but you learn how to treat yourself, and you learn that this is highly treatable, and then you learn to manage it yourself. And life is so amazing once you've learned how to do that. It's just such a gift.
Absolutely. And people will say that if you are no longer held back at all by your anxiety, don't be afraid to say that you're
Hmm.
cured. But if anxiety shows up again in a different area and suddenly, you can challenge that too. But I really say to people, don't be afraid to say that you're cured. It's not like you don't have an anxiety system, but it's now
Hmm.
within the normal range. So within the normal range, doesn't matter what, physical kind of ailment or any ailment we're talking about. If we get things into a normal range, I would say we're okay to even say we're cured, right? We will still have anxiety, but now we understand it's normal, natural, right? So, yeah, go for it. It's hard work, but I think I've seen so many people do so well, and I like the way you talk about it. I like the way you think about it. I think your
Thank
podcast
you.
can help people, on the road to that kind
Thank
of
you
a
very much.
journey,
It's quite the
right?
vote of confidence. I appreciate it. And just, all right,
Great.
amazing. I think we've really captured our topic well. I think we've given some good advice. I'm pretty happy with our discussion.
It was a great discussion. I really enjoyed chatting with you, and I always welcome an opportunity to get that message out there. So, well done for doing that, and sort of carrying the torch, forward for future generations. I'm sure we'll learn more, but we already know a lot in terms of how to
Amazing.
work with
Thank you
this.
so much. Thank you for helping with the opportunity to get this information out. Much appreciated.